He doesn't bite.
No, he doesn't.
All right, good morning, everybody. We probably doesn't surprise you with Chief Despain and Chief Cassidy up here that we want to talk about. Oh, Chief Cassidy is not up here. Come on up. Yeah. So we're going to be discussing the fire department, and it is especially great news today in the sense that the Federal Emergency Management Administration has awarded $2,268,000 and how many dollars? $290. And $258 to LFR for the staffing of adequate fire and response grant. So this is a huge federal grant that we commonly call the SAFER grant. I think this is one of the biggest ones we've ever gotten, isn't it? I didn't ask you that question, but this is large. Earlier this year, with City Council approval, LFR applied for the SAFER grant, requesting over $2 million to help fund 15 firefighter paramedics. For 3 years, the grant will help cover the salary and the benefit of these firefighters. As with many grants, there is a required local match, and our City Council, Benny Shob's here today, Carl's here today with us, Carl Eskridge, anticipated this match, and they provided money in the budget to meet the match, and accordingly there will be no new impact on the budget. The added personnel will help staff the new fire stations slated to open in 2019, 2020, and will also augment staffing in areas experiencing a high frequency of fires and other emergency incidents. Lincoln residents will benefit. The additional staff will help lower fire loss, put downward pressure on local fire insurance premiums, and provide overall a more reliable level of medical care, especially to areas surrounding the downtown and southeast Lincoln. The men and women firefighter paramedics, as you all know, do an outstanding job for the city, keeping us safe. Thank you, Ron Truba, President of the Firefighters Union, for what your men and women do for public safety, and these funds will help alleviate some of the stress in these operations in various places, allowing LFR to respond more broadly to the needs of the growing community. So with that, Chief Despain, Director Cassidy are here to answer questions. I don't know if Benny or Carl or Ron would like to make particular comments at this time. Ron?
Certainly.
All right. We are particularly pleased, I think, that there have been a large number of things since the Great Depression that the fire departments needed, and we're finally getting to the point where we're catching up on some things, and I'm glad to have the help of the firefighters in outlining and describing those things that we need to get caught up on. Thank you, Ron.
Thank you, sir.
Yeah.
Good morning. My name is Ron Truba. I'm the president of the Lincoln Firefighters Association, Local 644, and we're part of the International Association of Firefighters, a labor union that represents 313,000 union firefighters across the country. It is an obligation of the firefighters that are in that union to not only provide emergency services to the citizens, but also to work with the elected officials to help them understand the needs for resources within our local communities. So we do work with the city council members, we work with the mayor, state representatives, and we even work directly with the federal representatives. In this case, we have been directly involved with meeting with Nebraska's representatives in Congress, to get them to understand that the federal government has a vested interest in providing resources to the local community to make sure that they can respond to either man-made disasters or natural disasters, and that it is the local responders who are there first, even if federal resources show up later. And that is one of the purposes of the SAFER and FIRE Act grants. We have worked directly with them to make sure that they are funded each year. This last budget was approximately $700 million that was contributed out of the federal budget to these two different programs. And they are a very efficiently run grant program because they are peer-reviewed process that they are used to approve those and issue those out to local communities. So it is representatives from fire departments across the country, and we have used some representatives from here in Lincoln, Nebraska to partake in that process. But it's representatives from fire departments who review each grant and really determine where a need is. And so when we are approved for this grant here in Lincoln, Nebraska, it really shows that this was a genuine need and that other professionals in our line of work would find that this is a significant need in comparison to other requests that were made. So we're very grateful for this opportunity. We're grateful for the chance to work with our elected officials and bring those federal tax dollars back to Lincoln, Nebraska. And this is a great first step in improving some staffing levels to help the community and help firefighters provide a safer workplace.
All right, thank you. Anybody else? Questions?
No, sir.
Yeah?
What do you think was the selling point for the city and why were we picked among the other departments that I'm sure applied? What do you think was our case that was that we're seeing?
Chief, why don't I let you answer that because you've been involved in the day-to-day with the grant.
Yeah, so there's a number of metrics that we use to demonstrate performance or lack of performance. For example, cardiac survival rate or the influence that staffing and deployment have on insurance rates. And so we look at those measurements. We could articulate where we were in relation to where we could be if we got the additional staffing. And so a good example is there's areas of the city which we're building new stations and we're going to need some staffing for that, but our ability to put paramedics are already struggling even in the urban core. And so this additional staffing allows us to have a more consistent staffing model with paramedics. And so Southeast Lincoln, areas outside the downtown are going to have a higher likelihood of additional staffing and paramedics. And so we could articulate impact to, say, insurance rates. We would call it downward pressure on insurance rates. We could also call it definitive patient care, cardiac survival rate, a number of different metrics. And so once we were able to articulate that, I think that's what helped our scoring because they knew that once we're done, we were probably, compared to some other agencies, maybe more likely to show benefit.
I know the follow-up. For the mayor, do you believe that this will help reduce overtime spending of the fire department? And one of the problems that had kind of come with staffing levels remaining pretty stagnant for several years.
Yeah, well, firefighting, a number of things we do in city government, but I think the firefighting organization, because of the 24-hour on-duty demand, is particularly hard for management to deal with, relatively speaking, because of the 24 hours, because it's emergency services. And so we have to be acutely aware of how things change over time. And Chief Despain and Chief Cassidy have worked very hard on advising me with regard to changes that need to be made in management structure and in timing. Of course, all that has to be coordinated with the unions because they represent the firefighters and have ideas about how things can work better that are very useful. So we have worked hard to identify and to manage the things that need change. And we're working very hard right now on the overtime concept and how that can be made, can be improved in the short term and turns some of those savings into additional benefits for the public, among other things. I'm not sure that answers your question, but do you have anything to add?
Yes, it's a definitive yes, is that right now we have a number of slots we have to fill with existing staffing, and that staffing was established back when the city was running maybe 15,000 calls a year, and now that we're running 25,000 calls a year, they have to work extra hours, and I think most of the firefighters were fortunate that many of them are willing to do that to maintain service levels. But like the mayor said, the problem is, they work 24-hour shifts, and so to ask them to work an extra 24 now and then is part of the job, and they're willing to step up. But there's a point where we start seeing diminishing returns, burnout, additional injury. It costs us kind of money on the back end. So what we're seeing here is that these positions will actually dollar for dollar offset overtime. So firefighters will kind of go back to a more traditional model of their normal duties and a little bit of overtime and less of an impact. And just for the record, I think some of the controversy was the amount of overtime that some of those firefighters had earned, but the reality was the majority of the additional overtime was providing service to hurricane victims and provided by FEMA. So none of that was general fund money when we talk about kind of the higher end numbers. And so what we see now is those overtime could still look high, but that would depend on FEMA. The general fund impact will be actually net positive, meaning we'll actually save money in overtime.
Sort of practical question, when do we feel the grant additions take place, and does it add to the overall force strength for the department?
Right, so we had already planned on this, so we have a recruitment that starts on September 6th, I think, September 8th, applications open. We were already anticipating needing some additional staffing just due to attrition. This actually puts a little more pressure on staff to staff up quicker, but we anticipate the 15 positions, and it could be more than 15 based on attrition, but the 15 that would be associated with the grant, which we would call additional staffing, we believe we can bring those on by February, which would be required by the grant. That's the last day we can bring them on, is mid-February. And they will be approximately 6 months in training before they're actually in the field as minimum staffing. So it'll be almost a year from now before we actually kind of feel it. But when we bring them on day one, their salaries are, 75% of that salary is being covered by the federal government. Those are some positions we might have brought on anyway at full cost. And so again, that's that savings that we see. So a big benefit for us. And I think the measurements will start manifest sometime about this time next year.
Yeah, does it change the overall strength level of the department?
Yeah,
by 15 or
by 15. Yeah. So the full-time equivalent number would go up by 15.
For the mayor, can you restate quickly where the money came from and how much it was, the grant?
I'm sorry.
Can you restate real quickly where the money came from and how much the grant was?
Yeah, the grant was for a little bit over $2 million, and the money came from the federal government, which has what we call a SAFER grant program. It was described for you in great detail and very accurately by Ron. So that's basically the two basic facts about it. Okay.
One last question. Whenever you accept a grant from the federal government to offset staffing, how do you go about making that decision as mayor, as opposed to just adding them with the city dollars that you have? Because knowing that at some point that grant runs out and the city takes on the full cost of it.
Yeah. Well, obviously, at the beginning and at the end, you have to base what you're doing based on needs. And one way or another, those needs need to be satisfied if the public demands that, and they do. And so you go about figuring out how you can meet those needs in the most efficient way in terms of the use of tax dollars. And to the extent that there exists a very large grant program at the federal level that will take care of part of the expenses for part of the early years, it makes total sense to take advantage of those grants. And so we try to maximize our ability to participate in those programs. And one way we do that is to anticipate matches and budgets based on past experience with respect to the cooperation level that has historically been there. So, did I give you an idea? Good questions, Riley. All right, you good to go? Thank you very much.
Anybody need the exact amount? I've got it.